Now we're going to look at the elbow. We're going to start with elbow extension. So the patient is limited 15 degrees either side of the neutral 90-degree angle. So he's got a lot of pain, so we're working on a clinical group 3A, so we're going to address the issues of pain first. So the first thing that we're going to do is I'm going to just come under and cup his elbow here. And all I'm going to do is a grade, maybe I might start with a grade 1, which is just barely anything. And I'm just kind of oscillating him using my right arm to apply forces. And my left hand is stabilizing him under the elbow. This time I'm for sure going to make sure he's okay pain-wise. Are you doing okay with this? Again, I would check his face if he's kind of a stoic person, see if he's getting painful expressions. I might just want to do some rotary forces here. See if I could get any movement there. So I might move him into more of a grade 2, and it would be very slow and controlled. So grade 2 would just be staying in the pain-free range of motion. I'm just trying to loosen him up at the joint here. Okay, so again, a grade 1 would just be trembling, barely anything, trying to get him to work into a little bit more of extension moment at the elbow. And then a grade 2 would be a little bit larger amplitude, but again, just staying in the pain-free range of motion. And that would be it for elbow extension. I'm going to work on the patient's flexion. Again, we're treating his pain more than the stiffness at this point. So I'm going to ask him how he's feeling. I'm going to take my right hand, come across his forearm and support under the elbow. I'm going to use my forearm as kind of a stop point here. He only has about 15 degrees of available flexion. So I'm going to begin with just a grade 1. I'm just going to do gentle oscillations in a flexion movement. Real gentle, very small, just barely detectable for some pain relief. And then if he does okay with this, you're doing okay. Patient's okay. So I may just try to bring him into, I'm going to just do a little bit more range and do grade 2, which is just large amplitude, slow, controlled, in a pain-free range. And then again, I might bring him back and just bring him down to a grade 1 again, just very small, kind of trembling movements at the joint. And then I might try again to bring him into that grade 2.